homes. Now, you may think those are just little things, because that's what presidents do. They affect real lives, or they don't. And so that is the decision. It has been seriously argued in this campaign that anybody that fought for you before this election date should be eliminated from consideration for the presidency, because they are somehow tainted by the past. Seriously argued. And it's already worked. We got Senator Biden and Senator Dodd and Governor Richardson all eliminated. Biden and Dodd, two of the finest members of the United States Senate. Chris Dodd was the principal sponsor of the Family and Medical Leave Law, one of the most important bills I signed into law. Joe Biden, our senior foreign policy expert in the Senate, and the principal sponsor of the crime bill that put 100,000 police on the street and gave you 8 years of declining crime for the first time in American history. Maybe that's not transformative. Bill Richardson was, under my administration, the ambassador to the United Nations and the Secretary of Energy, and has been an outstanding governor of New Mexico, actually improving schools and bringing jobs and changing our energy future. Do we really believe that if you've done something for other people in your public life, you should be eliminated from being considered for the President of the United States? I don't think so. I don't think so. Now, that's what you have to decide. What is this election about? Hillary wants to bring America back, to have a new beginning by rebuilding the middle class, by reclaiming the future for our young people, getting the politics out of science and technology on stem cell research and human genome research and global warming research. And rebuilding the middle class by giving affordable health care to every single American, not leaving anybody out. Not leaving anybody out. You have a clear choice. She says, I'm tired of America making excuses in this one area. I'm tired of being told that we have to spend $700 billion more than any other country on health care, but we still can't figure out how to cover everybody. I will not accept that America is a can't-do country on this. We are a can-do country, and we can provide affordable health care to all of our people. But you have a choice. You can say these differences don't matter, but her main opponent says, well, we're going to have virtual universal coverage, meaning that I'll make it more affordable and I'm sure everybody will buy it. But the truth is that every expert who's looked into this, all the health policy people say that 15 million Americans will be left out under that. In other words, about a third of those who don't have health coverage still won't have health coverage if the alternative plan passes. Hillary says you're going to have to buy it, but you can keep what you got if you want it. If you don't like what you have or you can't get insurance, you can buy into a plan just like that which insures members of Congress and their families. You will have over 200 choices. And if you don't have children, either because you're younger or you're not old enough for Medicare, but your kids are gone, and you want a perfectly good plan that's less expensive, you can buy into one just like Medicare. If you can't afford it because it would take up too much of your income, you're eligible for tax credits, which are refundable. You get them anyway, even if you don't owe income tax. Now, and it'll be paid for by allowing the tax cuts on the wealthiest 1% of us, including our family, to expire. They never should have been enacted in the first place. And by proven savings in the medical system, and there are lots of them. Hillary and I took back-to-back trips a couple of months ago to the Mayo Clinic to talk to people there about work they were doing. And the doctors in the area, including doctors who did not work at the Mayo Clinic, said that if we manage the care of our people the way the Mayo Clinic does, giving everybody a medical home, and then sending at the earliest possible date to whoever they needed to be sent to stay well, it would cut medical costs 20% in this country and improve the quality. If we just gave everybody electronic medical records with privacy protections, it would save, the most conservative estimate is, $80 billion a year. That's 80% of what it costs to insure everybody. And those of you who are a certain age will know that. How many times you've been to the doctor where before you could get an aspirin you had to answer the same set of questions for an hour you've been answering since you were 12 years old? And I must say, for the younger people in this audience, I can tell you, there will come a time when you do not remember the answers anymore. But you still got to give them or they can't give you the aspirin. So you spend all that money and all that time, and then still, if you need care right away, we do billions of dollars of unnecessary tests every year because we don't have the records. And even after all that, we spend billions of dollars in medical errors every year because we don't have the records. This is the kind of thing that has to be done. But we have to insure everybody. And everybody will not buy the insurance unless you both make it affordable and tell them they have to have it. And then what will happen is young single people, for example, who think they're going to live forever. I was one once. First time they have a car wreck and show up at the emergency room, their costs will be passed on to everybody else. We'll be right back into the cost spiral soup. We have got to provide affordable health care to every single American. Nobody left out. Nobody.